Do you have pain or tightness in your trap area, or kind of some tightness in the pec area? Have you had any pain in your upper back or even in your cervical area? Do some people say that you're kind of hunched over all the time? Then you may have upper cross syndrome. Thank you for tuning in today to our channel, where we aim to give you, the patient, the most up-to-date information that is always evidence-based. My name is Alexander, and today we will be covering upper cross syndrome. All right, so let's start with our first question. How does upper cross syndrome cause back pain in the thoracic region? So this is going to be our main question, our main topic, and kind of the things that we're going to explain upon, as well as some other ideas as well. So other topics and questions that we're going to cover today is, what is upper cross syndrome? What are the causes? What other issues can upper cross syndrome cause? What structures are involved? Where can I go to get treated for upper cross syndrome? And how can chiropractic care help with the treatment of upper cross syndrome? So let's start with the first one. What is upper cross syndrome? So upper cross syndrome is caused by the postural imbalance and muscular dysfunction. It primarily affects the muscles in the neck, shoulders, and upper back. The name upper cross comes from the visual representation shown by the cross section, as we have here, of the muscles involved when looking at the body from the side. So we have some tightness in the upper area and lower area of the front side, and some weakness on the upper side of the front side and weakness of the posterior side here. So that kind of gives us that upper cross there. So what causes upper cross syndrome? There are two muscular groups that are responsible for the cross representation that is seen. So on the anterior or the front side, we can see that there's tightness that originates from the flexors and elevators of the upper body, as well as some issues with the pectoralis major or minor, the upper traps, the suboccipital neck muscles, lats, and biceps. On the posterior side or the back side, we can see that there's weakness from the muscles in the extensor group that are usually involved in aiding in a straight posture, as well as issues with serratus anterior, rhomboids, posterior deltoid, and the spinal erectors. We cover some of the specifics of these muscles in other videos, so feel free to check out the serratus anterior for scapular winging that we have linked up above. So what other issues are caused by upper cross syndrome? So we can see that there's weakness in the mid and upper back muscles, especially in the serratus anterior and the trapezius. You can also see that there are tight pectoral and neck muscles caused by the weakness in the mid upper back muscles. There's also some neck stiffness or pain, limited range of motion in the upper thoracic area, and this tends to force the shoulders to take more of a dynamic load, which can result in shoulder injuries along the way. So kind of my personal experience is how one injury leads to another. When I was wrestling in my younger years, I had an issue where I hurt my back, and I ended up relying on my outstanding structures, my elbows or my knees and my hands. And what ended up happening was I was counterbalancing myself and forcing myself to rely on my hands and knees more than my core or my back muscles, and I ended up dislocating my elbow. So this is how one of those injuries like upper cross syndrome can lead to a shoulder injury, or even back pain, or even upper back pain, and even cervical or neck pain. So what are the structures that are involved with upper cross syndrome? So we can see that there is an increased thoracic kyphosis. This is just the scientific term for saying kind of hunched over, hunchback. We can see imbalances in postural muscles such as the pectoralis major, upper trapezius, the sternocleidomastoids, that muscle that kind of you see protruding out of people's necks, the deep neck flexors, the lower trapezius. We can also see there's tightness in the postural muscles and stiffness in the cervical and upper thoracic regions. So what are the primary causes of upper cross syndrome? So there was a study that took a look at laundry workers who suffered from upper cross syndrome and their daily activities, and seeing which muscles were inhibited. Particularly the ones that were affected were the pectoralis muscle due to tightness, which was found in around 34% of these cases. The next one was the lower trapezius muscle weakness, which was found in 34% of these cases. And then the last one was the middle trapezius muscle weakness, which was found in 36% of these cases. So based on the literature findings, we can see that the primary cause of upper cross syndrome appears to be caused by tightness of the pectoralis minor muscles bilaterally, meaning on both sides, and weakness of the mid to lower trapezius muscles. The gradual shortening of the muscles on the anterior side or the front side of the body, in combination with the constant lengthening of the muscles on the posterior side or the back side of the body, is what leads to the progression of upper cross syndrome. And now this can cause some of that back pain, that jutted forward chin that we can see sometimes, that hunched overness of that overly kyphotic back, and that kind of leads to that progression. So some of the main individuals who are affected by upper cross syndrome are dentists, athletes, firemen, and long distance runners. One of the studies that we referenced at the end tends to show that most dentists or dental assistants or hygienists tend to retire because they are suffering from issues caused by upper cross syndrome. So now let's look at some of the muscles involved. So we have the pectoralis minor, as we have labeled up here. Its primary action of this muscle is stabilization, depression, abduction, protraction, and internal rotation, as well as downward rotation of the scapula. Now the other one that we have on the right side of the picture you can see here is the trapezius. And I like this picture because it shows different parts of the trap and different sections that are responsible for either elevation, retraction, or depression of the scap. So the primary action of the trapezius is elevation, retraction, and depression of the scap, as I said before. And the area of weakness in this muscle that causes the progression of upper cross syndrome are the aspects of the muscle responsible for retraction and depression of the scapula, not so much the elevation. So when coming into what exercises we can do for strengthening and stretching, we can look at some for pectoralis minor as well as some for trapezius. Now for pectoralis minor, we know that the primary issue that is caused by it is due to over protraction of the shoulders or over tightness. So you can do some of the doorway stretches that we've shown before, and I'll kind of go over those in a little bit. Make sure to still focus on strengthening the muscle, as it is an important muscle with many purposes, such as stabilizing the shoulder girdle as well as the scap. So some of the great ones that you can do for stretching and strengthening would be like incline bench followed by incline dumbbell flies, and we'll kind of go into that in a little bit. So for the trapezius, we know that the primary issue is concerning the retraction and depression portion of the trapezius. When people focus on strengthening and kind of exercising for the trapezius, they always do shoulder shrugs and not really focus on the other aspects of the trap. We know that the trap inserts at the external occipital protuberance. It's that little bump on the back of your head all the way down to the lower parts of the thoracic spine. So that's a really long area that it covers, and kind of that section that if you're just focusing on the top part, you're missing 2/3 of the muscle. So great exercises for these could be the deadlift or trap bar deadlift, rack pulls with a wide grip or wide grip rows, as well as face pulls. So let's kind of cover some of these exercises here. So we have some of the incline bench. So we would perform this prior to flat bench, and I'll tell you why. We have sets 5 to 6 working sets, repetitions 8 to 15, frequency 1 to 2 times a week. And the benefits is by focusing on incline bench rather than flat bench, you develop more functional strength that not only helps improve pectoralis minor mobility, but also targets the anterior portion of the deltoids. I'll give you a great example is that what sports related activity has you directly standing straight up and pushing this way? Very few. Most of the time you're leaning forward at some sort of angle and pushing forward. Even if you're a lineman, if you're a wrestler, if you're a hockey player, no matter what sport it is, you're always leaning forward and pushing, which is kind of targeting more of the pectoralis minor versus the major. Now the major is still an important part, but this allows you to develop more functional strength. And then you could follow this exercise by incline dumbbell flies, and you want to do around 4 to 5 sets, reps 8 to 12, frequency 1 to 2 times a week. Now the incline dumbbell fly allows for a complete range of motion that is often missed on a barbell bench. It also allows for a good stretch of the pectoralis minor after the muscle has already been warmed up. So you can kind of see the gentleman performing here. Now the next one that we have is a deadlift or trap bar deadlift. We can see that the deadlift focuses a lot on full body mechanics, especially on the traps and the glutes and even the hamstrings, as well as the quads, forearms, and other areas. Now you want to make sure that you do this after a complete warm-up. When I say complete warm-up, you want to be sweating at this point. If you go into this exercise cold, you'll tend to either hurt yourself, herniate a disc, or even rupture some sort of muscle. So make sure that you are warmed up and ready to go before you perform this exercise. Now the frequency that I have here is 2 times a week. The reps I have around 20, and you want to do 4 working sets. Now by doing this method, you allow for yourself to actually work with a moderate to heavy weight, not something crazy where you're doing 400 pounds one time versus 225 for 20 reps. Now by doing it this way, you're going to force yourself to do kind of a cardio type of workout, as well as strengthening the muscles along the way in a way that they target only the muscles but not put strain on the ligaments or tendons. You want to strengthen the muscle but make sure that your tendons or ligaments last you the 100 years lifespan that we're on this earth. The next one that we have is a wide grip row. And kind of see the animation here. You can either do it overhand or underhand. They're both great. You want to perform these on back day after pull down. These can even be done following regular rows for more muscle development. You want to do 5 to 6 sets, 12 to 20 reps, 1 to 2 times a week. And by performing wide grip rows, you can target the portion of the trap which is responsible for retraction. The next great one are face pulls. So you want to perform these on back day as well. 3 to 4 sets, 10 to 15 using light to moderate weight, 1 to 2 times a week. Now the benefits of these is that they target the middle and lower portions of the trap. They're beneficial as the literature shows us that the middle and lower portions of the traps are partially responsible for the progression of upper cross syndrome. And why I say partially is that the front is tight and the back is weak. It's over lengthening. So you want to strengthen these muscles as well. So we can kind of come back to our main question. How does upper cross syndrome cause pain in the thoracic region? We know that weakness of the trapezius causes tightening of the pectoralis minor, or the muscles in the front, and the neck muscles, which results in a pulled forward posture, kind of that part of upper cross syndrome. Now, this progression causes pain throughout the upper body, which includes the shoulder and the neck. This often results in reduced range of motion. So how can chiropractic care help with upper cross syndrome? We have a couple different things that chiropractic physicians are specialized in, and some of them are spinal manipulation, which helps to improve the spinal movement and joint mobility. Manipulation of the spine aims to help restore proper posture and mobility in order to allow for normal dynamic movement that is often inhibited in individuals with upper cross syndrome. We also have joint mobilization. So chiropractors and physical therapists are well trained in joint mobilization techniques that allows them to gently target the joints that are limited in their normal range of motion. Another technique are soft tissue techniques, which include massage and myofascial release. These techniques are often used to alleviate any pain or spasms caused by dysfunction that is often found in the musculature of individuals with upper cross syndrome. We have exercise protocols, as some of the things we kind of described before, and then pain relief, just general pain relief. Chiropractic care often helps alleviate pain that is musculoskeletal in origin. Here's some of the sources. That's really all I have for you guys today. So if you have pain in the upper neck area, kind of that jolted forward issues, then you may have upper cross syndrome. So make sure that you get treated for it. I hope this video was helpful and informative. If you did find it helpful and informative, please like, share, comment, and subscribe, as it is the best way to support our channels. Thank you so much and have a wonderful day.